You know that feeling when you get a lab report back and you're staring at it, and it feels like you need a secret decoder ring just to figure it out? Well, today we are cracking the code on one of the most common tests out there, the blood sugar test. We're going to break down what it is, how it's done, and what those numbers are actually trying to tell you.
And really, this is the big question, isn't it? Is your blood sugar in a healthy, safe range? Think of it like a direct message from your body, giving you a real-time update on how it's managing its fuel. So let's learn how to read those messages together.
All right, so here's our game plan for today. First, we'll cover why we even measure blood sugar. Then, we'll get into how it's actually done. After that, the big one, how to make sense of your numbers. We'll also touch on what it means if those numbers are a little off, and we'll wrap up with how to get ready for your test. Simple as that.
Okay, let's kick things off with Section 1. Why even do this? Before we get into all the nitty-gritty details, let's talk about the fundamental reason for this test.
At its heart, this test is pretty simple. It's just measuring the amount of glucose, or sugar, that's floating around in your blood. Now, glucose is basically the main source of gasoline for your body's engine, so the biggest reason we check it is to screen for and help manage diabetes, a condition where the body's fuel regulation system is just a little out of whack.
So we know why we're checking for it. But how do doctors actually get that measurement? That brings us right to Section 2. How is it done? And the good news is, the whole process is really straightforward.
You've basically got two main ways this goes down. First is the fasting blood sugar test. This is kind of the standard one, done after you haven't eaten for a while to get a nice clean baseline reading. Then there's the post-meal blood sugar test. Just like it sounds, it checks how your body handles food, and it's often used when a doctor already suspects or knows that diabetes is part of the picture.
Now for a much more detailed look, there's something called the glucose tolerance test. I know the name sounds a little intense, but it's really just a few simple steps. They'll take a blood sample as a baseline, then you drink this standardized super sweet drink, and after that, they just track how your blood sugar changes over the next couple of hours. It's basically a stress test for your metabolism, and it creates this amazing map of how your body responds to a direct sugar challenge.
All right, we've nailed down the why and the how. Now for the part you've probably been waiting for. Section 3, understanding your numbers. What do these results on your lab report actually mean? This is where we turn that raw data into useful information.
The first concept you got to get your head around is the normal range. Think of this as the green zone on a gauge. If your numbers fall within this range, it's a great sign that your body is handling its glucose levels efficiently. It's the healthy baseline that everything else gets compared against.
So what is that green zone? Well, for a standard fasting test, the one taken when your stomach is empty, the normal range is somewhere between 70 and 110 milligrams per deciliter. Landing right in that sweet spot is a fantastic sign that your body's energy system is humming along perfectly while it's at rest.
But what about after you eat? I mean, of course your levels are going to go up as your body starts processing that food. That's totally normal. The key is that they don't go up too much and that your body brings them back down efficiently. So about 2 hours after a meal, the target is to be below 120.
So what's considered outside that normal range? Well, on one end, you have hyperglycemia. That's just a fancy term for high blood sugar, which is a fasting level over 140. On the other end, you've got hypoglycemia, or low blood sugar, which is a level below 60. These are the key thresholds that act like a flag for your doctor, signaling that something might need a closer look.
Now, this next part is really, really important. Seeing an abnormal number is not a diagnosis. Think of it more like the check engine light in your car. It's just a warning sign, a critical piece of data that helps your doctor know where to start looking. This is just for your understanding, definitely not for self-diagnosis.
For example, when that check engine light is flashing for high blood sugar, what could be going on? While it's a classic sign of diabetes, it can also be a clue for doctors to investigate other things that affect your metabolism. We're talking about hormonal issues like with the thyroid, or problems with organs like the liver or pancreas. It's a starting point for their detective work.
And on the flip side, low blood sugar is also a really significant clue. It might suggest the body is pumping out too much insulin, or maybe it points to issues with the glands that regulate your energy and stress response, like your adrenal or pituitary glands. But remember, these are just possibilities, data points that help guide a medical professional's investigation.
Okay, since these numbers are such an important signal from your body, you want to make sure that signal is as clear and accurate as possible, right? That brings us to our final section, how to prepare for your test.
This is all about giving your doctor the cleanest data to work with. So, rule number 1, be totally upfront with the staff. Tell them about any medications you're taking because some things, like steroids or diuretics, can definitely affect your results. Same goes for any temporary situations, like if you have a fever, are under a ton of stress, or are pregnant, all of which can throw your numbers off. And yeah, it's probably a good idea to skip that intense workout and the glass of wine the night before. Just try to keep things as calm and stable as you can.
And this brings us to what is, without a doubt, the most important takeaway of all. If your results come back outside the normal range, your first step is not to worry or start Googling symptoms. Your first step is to talk to your doctor. They are your partner in this. Together, you can create a plan that works for you, whether it involves changes to your diet, your exercise routine, or medication. You're a team.
See, a blood sugar test isn't just a number on a page. It's a conversation with your body. And by understanding what it's telling you, you're taking an active, powerful role in your own health. So, now that you have the tools to interpret the language of your lab report, the only question left is, are you ready to listen?